Hello, my name is Ralf Friedrichs. I'm an addiction recovery coach and the host of the Take Your Life Back Today show. As an addiction recovery coach, I want to share something with you. Let me be crystal clear to leave an everlasting impact. Just imagine, being buried alive. You're in a coffin, but you're not dead. You try to lift the coffin lid, but the enormous weight of dirt upon that lid is preventing you from opening it to get help. You just say, today I'm going to die. But then you think, if I bang on the lid, bang real hard, maybe I'll unsettle the dirt, and just maybe someone on top might notice and start digging their way down to help me. This is what it's like to find yourself at the lowest point of alcohol and drug addiction. You know you need help, you know you can't do it on your own, but you don't know where to turn for help. In reality, there are probably people standing right there, on top, by your grave, but you don't know that. You just think you're going to die. Usually, though, people don't think about death when they're habitually abusing drugs and alcohol. In order to feed an addiction, you have to be great at repressing the fear of death. I often ask you, my audience, did it ever cross your mind that what God gave you, life, by you abusing drugs and alcohol, that you are taking away what God had given to you? Not just from yourself, but selfishly, you take it away from your children, your grandchildren, your mother, your father, your husband, your wife. With this, let me leave one last thought. Don't be the person that I'm reading about on these index cards that waited way too long to get help when it was too late, could not get help. Instead, be a person that reaches out today and asks someone for help. In the previous episode, I talked about the 4 steps that are needed to start. First step is first of 9. If you have a problem, the first step is to say, I have a problem. Step 2, go seek help. Reach out to someone like me. You can call me at 844-405-HELP. You can reach out to me for help. Step 3 would be then to come up with a plan to live life in recovery, to live life as a sober person. And step 4 is to surround yourself around people that you know are living a life of sobriety. 4 steps. Admit you have a problem, reach out for help, come up with a plan for your future, and surround yourself with different people. Folks, you can call me at 844-405-HELP, and I promise you, I will help you take your life back before your life is gone. Let me just shut this down. People like Larry Geis from the Geis Academy at 516-458-2741, 516-458-2741. Larry Geis, like I am, addiction recovery coach. We're life coaches. He will help you from your addiction to your recovery, from your depression to happier times, from your low self-esteem to higher self-esteem. You can Google him at www.odysseyconsultant.org. You can call him at 516-458-2741. Larry Geis and myself always tell people like you, it doesn't matter where you came from. It doesn't matter where you've been. What matters most is that you're here reaching for help. Today, call Larry at 516-458-2741. I don't know if anyone out there either has diabetes or you've seen some of these early signs, but today we're going to talk about, do you recognize these 11 early warning signs of borderline diabetes? What you need to know about borderline diabetes. Diabetes does not just develop overnight. Borderline diabetes may have no symptoms at all, or you may experience one or more of the symptoms that I'm going to discuss. You can prevent diabetes if you identify borderline diabetes early. What you need to do with borderline diabetes. If you have any of the symptoms that I'm going to discuss, please check with your health care provider. If you are a high-risk group, then you should also get pre-screened constantly for pre-diabetes, even if you do not have the symptoms. First of all, what is borderline diabetes? Actually, there is no medical diagnosis called borderline diabetes. Rather, borderline diabetes refers to a medical condition called pre-diabetes. This is when your blood glucose levels are higher than normal, but you are yet not high enough to be diagnosed as diabetes type 2. People with borderline diabetes or pre-diabetes are more likely to develop diabetes type 2 and may already have some of the signs and symptoms of diabetes. Many times patients with borderline diabetes, otherwise known again as pre-diabetes, will not have any of the signs The following signs and symptoms indicate you have borderline diabetes, otherwise known as pre-diabetes. Let's go and discuss these. Number 1 is increased urination and thirst. As your blood sugar rises, your kidneys become overwhelmed and you begin to pass sugar in your urine. Your body takes fluid from normal tissues to help excrete the blood sugar from the body. This causes you to urinate more frequently and can lead to dehydration and subsequently make you thirsty. As you drink more fluid, you then subsequently will urinate more. Number 2, hunger. With borderline diabetes or prediabetes, your body begins to become resistant to insulin. You become more hungry because your sugar is not able to enter the cells. This can also lead to hunger even after you have just eaten. Number 3, dry mouth. This results primarily because increased urination and dehydration that results from elevated blood sugar levels as described above. Number 4, tiredness. Fatigue and borderline diabetes, prediabetes, can be from a number of different causes. When your blood sugar is elevated, your body is just not working the way it should be. It's not working properly. You do not use sugar appropriately, and constant state of dehydration both contribute to the tiredness many borderline diabetics feel. Visual changes. Elevated blood sugar causes changes in the eye that can make it more difficult to see. In general, the lenses of the eye can become distorted and stiff, making it more difficult to focus. Over the long term, there are a number of different complications to the eye if diabetics do not get help that they need. Number 6, itching. Dry, itchy skin is not uncommon in patients with elevated blood sugar. Additionally, itching is common in the genital areas and lower legs. This is often due to dry skin that results from previously mentioned dehydrated state that happens in borderline diabetics. Number 7, weight changes. Significant weight changes are more common in type 1 compared to type 2. However, if you have lost weight or you feel hungry all the time, you should let your doctor know and get tested for borderline diabetes / prediabetes. Number 8, rash. Anthocothis nigricans is a brown to black hyperpigmentation of the skin. This is a benign condition that is commonly seen in obese patients and have insulin resistance. When your blood sugar gets under better control, the rash may improve. Number 9, numbness in the hands and feet. High blood sugar levels over a long period of time can damage your nervous system. This can result in decrease in sensation and feelings of numbness and tingling in the hands and the feet. This is also known as neuropathy. Decreased sensation in the feet can also contribute to frequent injury and development of diabetic foot ulcer. Number 10, poor healing. A number of different factors contribute to poor wound healing in patients with elevated blood sugars. This range from decreased immune response to decreased function of the actual cells that heal the body. If you frequently have wounds that seem to take longer to heal than normally, please get checked. Number 11, sexual dysfunction. While some sexual dysfunction is common and increases as you get older, sexual dysfunction is more common with elevated blood sugars. This is generally not the symptom of borderline / pre-diabetes because the high blood sugar levels leading to the nervous cardiovascular changes generally take many years to develop. However, elevated blood sugar levels can lead to dryness in the genital area, making sex very uncomfortable. What do you do if you have any of these borderline symptoms? If you are experiencing any of the signs I just discussed with you, please go see your healthcare provider. I'll go over the 11 again. First of all, what is pre or borderline diabetes? Actually, there is no medical diagnosis called that. It is more often referred to as pre-diabetes, and that's when your blood glucose levels are higher than normal but not yet high enough to be diagnosed with full-blown diabetic. Symptom 1, increased urination and thirst. Keep in mind, if you constantly drink, you're going to urinate. But what is causing that constantly drinking? Is it something to do with pre-diabetic? Number 2, are you eating? Even after a full meal, are you still hungry? With borderline diabetes, your body begins to become resistant to insulin. Dry mouth. Do you have cotton mouth? The results primarily because increased urination, dehydration that result from elevated blood sugar levels as described above. Number 4, tiredness. Fatigue and borderline diabetes can be a number of different causes. When your blood sugar is elevated, your body is just not working properly. You do not use sugar appropriately, and that is causing the tiredness and the fatigue. Visual changes. Elevated blood sugar causes changes in the eye that can make it more difficult for you to see. In general, the lenses of the eye can become distorted and stiff, making it more difficult to focus, folks. Over the long term, there are a number of different complications to the eye if diabetes is there. Number 6, itching. Dry, itchy skin is not uncommon in patients with elevated blood sugar, especially you'll have it down by your legs. Weight changes. If you're suddenly losing a lot of weight, please go see your healthcare provider. Rashes. If you start noticing a brown or black hyperpigmentation of the skin, especially with obese folks, that's when your blood sugar gets under the better control with the care of a healthcare provider. Numbness in the hands and the feet. High blood sugar levels over long periods of time can damage your nervous system. This can result in decreased sensation and feelings of the numbness and tingling in the hands and feet. Poor healing. If you have had a rash or a cut and it's taken forever to heal, a number of different factors contribute to poor wound healing in patients with elevated blood sugars. These range from decreased immune response to decreased function in the actual cells to heal your body. If you frequently have wounds that seem to take a long time to heal, please go see your healthcare provider. Last but not least, number 11, sexual dysfunction. While some sexual dysfunction is common and increases as you get older, sexual dysfunction is more common with elevated blood sugar. This is generally not a symptom of borderline diabetes or pre-diabetes because the high sugar levels leading to the nervous cardiovascular changes generally take many years to develop. However, elevated blood sugar levels can lead to dryness in the genital area, making sex very uncomfortable. Folks, if you have any of these symptoms, please see your healthcare provider or your doctor. It's so important. Diabetes is very controllable if caught early enough. If you had any of those, do something about it today. I hope to God, no matter where you are, you have the best day. I hope this was very informative. I know it is for me. Being that I believe matter of fact, I know they're diabetics in my own family, so I constantly keep an eye on this. But I hope you have a great rest of your day and a sober rest of your life. And please, if you have any of those signs, speak to your healthcare provider. May God bless you.